Hey, thank you everyone for taking the time to join us today. From the Legislative Building in Regina, we have Health Minister Paul Merriman and SHA CEO Scott Livingstone. We'll start with opening comments and then move to questions. Minister?
Thank you very much. Good afternoon, and thank you for joining us here today. Today we are announcing the launch of our new vaccine appointment booking system. Everyone in Saskatchewan will soon be able to book your own appointments to get your COVID vaccine shot, either online or by phone. The website is saskatchewan.ca/COVID-19-vaccine. You can also find it on the homepage of the Government Saskatchewan website, saskatchewan.ca. The toll-free number is 1-833-SASK-VAX with an X. That's 1-833-727-5829. Note that that is a 1-833 number, not a 1-800 or 1-888 number. Both the website and the toll-free number will go live tomorrow at 8 o'clock in the morning. Tomorrow appointments will be opened up to all Saskatchewan residents age 85 and older. If you are in that group, or if you are acting on behalf of somebody in that age group, like a parent or grandparent, go online or call and book an appointment starting tomorrow at 8 a.m. I also want to stress that if you are not 85 or older or helping someone that is 85 or older, please do not try to book your appointment right away. We will be opening the booking system to more people in the days ahead by descending in age order. So please be patient. We are going to go as fast as the vaccine supply allows us to, and you will be able to book your appointment very soon. So everyone should book your appointment and get vaccinated as soon as you're eligible. But again, please wait your turn. If you do try to book an appointment outside of your age group, you will not be allowed to, and you will tie up the system and slow down the bookings for seniors who are eligible to book. When the system goes live tomorrow, there will be approximately 100 different locations where you can book your vaccine shot. So no one should have to travel too far. The pace of the vaccine deliveries to Saskatchewan will be picking up significantly in the coming weeks, but we still expect demand to exceed supply. So appointments will fill up very quickly, and we may run out of available appointments sometimes in some locations. If that happens, again, we would ask for your patience. More appointments will be open as soon as more vaccines are available. The most important thing we can do to protect ourselves and others and get life back to normal in Saskatchewan is get vaccinated. The road out of this pandemic is through widespread vaccination. And now with our new booking system, you can plan your own trip. So please do so. When it's your turn, make an appointment and get vaccinated. Because when you do, you're not just doing this for your own shot. You're doing this so you can plan the next big event with your family together. You're also planning that your kids and you can get back to your favorite sports and activities. You're planning a safe trip to see your parents or grandparents or long-term care facility. You're planning your next trip to the Rider game at Mosaic Stadium or the next concert. You're planning how life gets back to normal and how we have a great Saskatchewan summer. Now that's what you are planning when you book your appointment. So when it's your turn, make your plan, book your appointment, and get vaccinated. Thanks, and I'll turn it over to Scott.
Thanks, Minister. Before I begin, I'd like to express my condolences to the families of those who've lost a loved one to COVID-19 in the last few days. I also would like to thank our healthcare workers who have been working so hard to fight this virus and now the rollout of our vaccine. Sorry, I switched to technology today. I want to assure them that all the hard work in saving lives and is helping us move closer to ending this pandemic. Today I'm joined by Derek Miller, who is the commander of our Emergency Operations Center, and Michelle Mula, who's our Executive Director of Digital Health, and she's the lead for the new online booking system. I'm going to hand it off to them in a moment to take you through the new booking process of the vaccine, but I also want to start by saying that, like we've asked for many months and many times in the past, the help of the public through this new process of booking vaccinations. As the Minister has highlighted, we will be able to roll out our vaccines faster, but only if those who are eligible use this process first. So starting tomorrow, that will include those individuals 85 years plus. As we've seen in other jurisdictions, call volumes to their booking centres have far exceeded the number of those eligible. This has created a number of challenges for them, including unnecessary stress on critical infrastructure, and may cause delays when the overall vaccine rollout. We certainly want to avoid that. The key thing for the public to know that their turn is coming soon, very soon. As you heard the Premier say yesterday, we are expecting as much vaccine in the next 3 weeks as we have received in the entire first 3 months of our campaign so far. With that volume of vaccine increasing significantly, we will start opening to new age groups fairly quickly in upcoming days. So with a little patience, this will ensure our entire population is protected faster. And only that, and that gives us more hope to returning to what our new normal will be. We're in this together, and with that, I'd like to hand off to Derek to deliver an overall presentation on the booking system, and then on to Michelle, who will walk us through a demo of the booking system. Go ahead, Derek.
Thank you, Scott. And Minister, I'm happy to join you this afternoon to give an overview of the rollout of the new patient booking system. The booking system will support us in achieving our campaign goals, which include protecting those most vulnerable, minimizing serious illness and death, protecting our healthcare capacity, and minimizing the spread of COVID-19. We will immunize as many people as possible, as quickly as possible, as speed matters, as every day counts to save lives and reduce the overall impact of COVID-19 and allow us to return to a sense of normalcy. The SHA patient booking system has a number of benefits. It's simple, fast, and easy to use. It will improve our ability to schedule patients in for their vaccinations, as well as reduce delays in that process. It will help us avoid long lineups and reduce the risks of COVID that might be associated with those lineups. There's a choice of online or telephone booking, and also there's the ability for support people, family, and friends to assist others in making their bookings. And lastly, the system allows us in the future to expand to other services such as COVID testing, as well as non-COVID services such as lab and other areas. Two key pieces of the patient booking system include online and phone booking. Here are just a few points on the online booking system. It is the fastest way to get your appointment, and it's also available 24/7. It only takes a few minutes, as you'll see in a demonstration in a few moments, and it's accessible through the Saskatchewan.ca COVID-19 vaccine website. From that site, you can also cancel or edit appointments that are made in the same place. The application is easy to use and accessible from your desktop, as well as it's mobile friendly. Individuals will receive a notification by email or text, providing initial notification of their appointment details for future reference, as well as a reminder 24 hours in advance of your appointment. The system was built with privacy and security top of mind to ensure the protection of citizens' information. Just one important point to note, all appointments that are available will be shown online. So by calling in, there's no additional access to further appointments. They're all shown to people accessing through the online system. The phone system, as mentioned, through the 1-833 SAS-VAX phone number is an option for people without a health card or for those that may require an extra level of support. Emphasizing, though, that we're asking people to use the online system as much as possible to ensure that those who need the phone support can access it seamlessly and as easily as possible. The phone line will be open daily, 7 days a week, 8 a.m. to 11 p.m. We have capacity for 6,000 bookings per day through the phone system, and that's in addition to the bookings that will occur through the online system. This phone number has been achieved or set up as a separate number from its other health services such as 911 or Healthline 811 in order to protect those critical services and avoid confusion. The rollout of the SHA booking system will start tomorrow at 8 a.m. and it's open to those 85 years of age and older. So we're starting with this smaller subset of eligible population to help us align the demand to make appointments with vaccine availability, appointment availability, as well as to manage the overall access to appointments. We will be moving through the age groups sequentially in descending order to fill appointments out through the coming weeks of March and then on through April and beyond. As we move through the age groups, the size may vary. We're going to be looking at the populations within each age group to allow us to roll it out to the appropriate size of population at any given time to match the availability of vaccine, which is really going to be the driver in terms of the speed of progression through the ages. This is probably the biggest question that everybody wants an answer to. How do I know when it's my turn? Well, we are going to provide public communication every time there's an expansion of the age group access. This will be provided through a public service advisory that will occur when we expand the age groups and expand the eligible people that can book online or on the phone. That information will also be shared in the daily COVID news release provided by the government and shared through various social media channels. At any time, you can go to Saskatchewan.ca COVID-19 vaccine website and check to see what the current age group is for accessing appointments and then go from there to actually book your appointment. An important point is that once you become eligible, you're always eligible. So even though we're moving through the age groups, everyone who was previously eligible can always go online and book an appointment if people change their mind and want to seek access, or maybe they weren't available went earlier in the process. Once you're eligible, you're always eligible. And another important point, during phase 1, we have been contacting individuals directly through phone calls, and we're going to be phasing out that system and promoting the online booking system, as well as the phone call in for those that need that extra support. As vaccine supplies increase in the coming weeks, we are going to be expanding the number of clinics that are available and the options for the public, including drive-through, mobile and pharmacy, community pharmacy access. At this point in time, our focus is still on immunizing our highest risk populations, and we will be starting phase 2 as soon as possible and by April as our vaccine supplies become more stable. Important things to remember. So please, as emphasized already today, don't call unless you're eligible. A high volume of ineligible residents seeking appointments at this point in time will stress our critical infrastructure and impacts everyone else who is eligible, who's actually trying to book an appointment. The phone line is for booking eligible clients only. Another thing to remember is that the clinics that you'll see when you go into the booking tool are limited by appointment availability, which is driven by the vaccine supply that we have on hand. The clinics that are listed do not represent the number and different locations of clinics that we plan to offer as we roll into phase 2 and as vaccine supplies continue to increase. So you may have seen on previous presentations that talked about the phase 2 rollout where we would be offering clinics, and you might be wondering how come they're not showing up. And it's because we haven't achieved the level of vaccine supply in order to open up all of those different access points. And that will come when we roll into phase 2. So please be patient. This does not apply to the ages of 60 to 64 that are currently eligible for the AstraZeneca, and additional details on the rollout of AstraZeneca vaccine will be released separately. A few key messages as part of our Faster, Smarter, and Safe campaign. We have made great progress in the past few months in protecting our most vulnerable and at-risk populations. Speed matters. Saskatchewan has led the charge across the country in terms of getting needles into arms faster and not having vaccines sitting in refrigerators. The SHA patient booking system is simple, it's easy to use, it only takes a few minutes, and is a critical enabler for our campaign as we move from phase 1 into phase 2 over the coming weeks and start opening up immunization to the general public. At this point, I'm going to turn the presentation over to Michelle Mula to take us through a live demonstration.
Good afternoon, everybody. My name is Michelle Mula. I'm the Digital Health Chief for the SHA Emergency Operations Center. And it's my pleasure to be walking you through the SHA patient booking system today. So as you've heard, our government has announced that we are opening up the online booking system starting tomorrow. And a Saskatchewan family hears the announcement and everyone rallies around Grandpa George, who is living at home, to get his vaccine appointment booked. I'm his granddaughter, Michelle, and I'm going to get Grandpa booked in today. After tomorrow, I'm able to go to the Saskatchewan.ca website where I will find a book online link. So when you click that link, you are going to come to the landing page of the booking system, which you're seeing now. And it outlines that you do need a provincial health card and either a cell phone or a valid email address to book online. If you do not have a provincial health card, or email and phone number, you are able to call the 1-833-SASK-VAX or 1-833-727-5829 to book your phone appointment via phone. So I'm going to go ahead and click I agree. So my intent today is to walk you really through the booking system. And while walking through it, I am going to show you a few of the messages that you will receive if you are not eligible or you are missing information. We want you to be familiar with it and know the required information that you are going to be needing to enter in so that you know what to expect. So to get started, you do need your provincial health card number, and you are required to enter in your date of birth. And if you entered in your date of birth and you are underneath the age of 85, you will be asked to come again when the eligibility gets to your age. So for today's purposes, I am going to walk through with some demonstration data. And I am booking my Grandpa George. He has just turned 90 years old today, this year. I'm entering in my date of birth for Grandpa. Okay, and I'm going to hit next. And now it brings me to the vaccine screening questions. So it is asking you to take a moment to review the screening questions, and when you click this link, it will open up Saskatchewan.ca's website, where it will give you an overview of the vaccine screening information and FAQs. You are simply able to click back to the tab for the Saskatchewan booking site and continue your journey once you've reviewed your screening questions. I'm going to click next. Acknowledgement and consent. So this page just simply outlines that you will not be able to receive the vaccine if you do not meet the criteria, that your appointment is subject to change. However, by entering in your cell phone or your email address into this booking system, you will be notified of any changes to your appointment, and that your information is true and correct, and that it is today. I will hit accept. So we currently are only booking first dose appointments at this time. The system will be opening up to second doses when the government announces that we are moving forward with second dose appointments. And if you were to try and click the second dose appointment, you are presented with a screen that says we're not currently booking second dose appointments, but hang on to your vaccine card because you will need that when it becomes time to do so. I'm going to click first dose appointment. So it is now prompting me with a map view that you should be familiar with. We have a couple different views that I will walk through with you. By hovering over any of the sites, this is showing you all of the clinics that are booking appointments and have availability. So by simply clicking on one of the sites, you're able to schedule your appointment. So my grandpa is from Esterhazy, Saskatchewan, so I am going to type in Esterhazy, and it will come up and zoom right into a clinic nearest Esterhazy. Now, it happens to be that Esterhazy does have a vaccine clinic, so it's showing me here. I'm also able to zoom out and see any clinics near me. And you are able to book into those if there's an appointment that suits your needs. I will show you one more view on here. Should you not like the map view, there is a list view here. All of these clinics, again, are booking appointments, and it is sorted in alphabetical order. So I'm just going to scroll down the list and click on Esterhazy. So it's now prompting me with the next available appointment. So it is showing that on March 16th at 8:30 is the first available appointment in Esterhazy. That appointment doesn't work so great for Grandpa, so I can come down here to click on the calendar view and select any of the appointments that are available that day. So 9 o'clock on March 31st is going to work great. I click next. And now I'm entering in information that's required for booking. We are asking to either enter in email address or a cell phone number. I'm choosing to enter both. And I am going to enter in my own cell phone number so I can help keep Grandpa up to date with his vaccine appointment. Enter in the town. And consenting to receiving communication via email and text messaging. So Derek did mention that you will receive a confirmation email when your appointment's booked through text and or email, as well as it will keep you up to date of important clinic information and send you a reminder 24 hours in advance of your appointment. We ask that you click on the CAPTCHA and walk through any of the steps. We have included this to ensure that our site is safe and secure from a cybersecurity perspective. And now it brings me to reviewing my appointment information. So I am just going to take a quick glance over my information that I've entered in, and the appointment information looks great. And by booking my appointment, I am going to receive a text message and an email address with the confirmation. From here, I can print myself a copy or my grandpa a copy of his appointment information, and that brings you to the end of the journey. So this brings me to the end of the walkthrough for the SHA patient booking system. I did show you a few extra pieces today, which took a little bit of extra time. However, the entire process should just take you a few quick minutes to book your appointment. You are able to use your computer, your iPad, your phone, and the system is fast and easy to use, and it will be the fastest way to book your vaccine appointment online. We are looking forward to giving you the ability to book your appointments online starting tomorrow. I'll now hand it back to Derek.
Thank you, Michelle. And we're going to go back to Scott for his closing remarks.
Thanks, Michelle and Derek. I'd just like to start again by thanking healthcare workers and our leadership team at the Saskatchewan Health Authority, as well as our supporting partners. After a full year under unprecedented pressures, our healthcare workers keep finding ways to serve our patients and residents better. We already lead all provinces in getting vaccines into the arms as quickly as possible, but this booking tool is another tool in the toolbox that will help us deliver COVID vaccines faster and more effectively. It's also a system that we can build on after the pandemic to create more seamless access for our patients to the services they rely on. While there no doubt be some wrinkles as the process rolls out, in the big picture, it is going to speed up our immunization campaign and help us return to normal quicker. It is a major step forward in the program. Thank you, and with that, I'll turn it over to Matt for questions.
Perfect. Thank you, everyone. We'll now move to questions.
We'll start with
our first question on the phones.
We have Roberta Bell with Global.
Hi, I just wanted to clear up regarding when people. When will the first age group that's starting with this system, when should they expect to be fully vaccinated, and when do you expect that everyone in Saskatchewan who wants a vaccine will actually be fully vaccinated?
Thanks, Roberta, for the question. We're still anticipating that phase one is going to get done right away, probably by the end of the month. Premier outlined yesterday where all of our phases are going to be in our age categories. To answer your question directly, if vaccine supplies stay consistent for the next few months, we should have everybody done early in June if that everybody that wants to be vaccinated can be vaccinated by that point in time.
Scott?
So the only thing I would add is when you say fully vaccinated, I would include second shots in that. So following Minister's comments around being phase one done, phase two of the first vaccine done, we will start vaccinating second doses as soon as we can, and we expect to see that supply flow in the same matter and volume that the flow will occur in the highest points of vaccination programs. So depending upon uptake, but certainly, having everybody with 2 shots in their arm is certainly doable, we believe, by fall of this year. But certainly, as Minister pointed out, first vaccinations will be done sometime, hopefully mid-June.
Follow up, Roberta?
Could you clarify what the plan in the works is for the Johnson & Johnson vaccine when it does start rolling out here in Saskatchewan, given the fact that you're looking at 2 doses with every other shot?
Maybe just to start, well, any vaccine that we get is a good vaccine and we can get into somebody's arm. Obviously, Johnson & Johnson with the 1 shot, that'll expedite things very much when we get those. We're hoping to be able to get an early shipment of Johnson & Johnson so we can add that into our complement of our other vaccines that we have on hand.
We'll take a question in the room. Steph?
For either of you, now that we're moving to a self-booking system, is there going to be any way to keep track of people who choose not to get vaccinated? I know there probably is going to be some privacy concerns and whatnot, but any way that the health authority is going to be kind of watching that? Or how many, to get a sense of how many people may not actually choose to get vaccinated?
So what we would know, Stephanie, from the health registration system is the amount of individuals within each of those particular age groups. So certainly we'll be tracking the uptake of vaccination in those age groups, and in particular then, looking at where we are, for example, with the 85 pluses. And if we see, an influx of appointments being booked, and then they'll start tailing off very quickly after a couple of days because we've got a high proportion of them done, then we'll move on to the next age group. So for example, we know today that in the over 80 group, we're about 40% done province-wide for those eligible as of today. And that would be the very high 80s. But yeah, we will be tracking at that level, so the percentage of uptake within the groups, and certainly the advertising campaign that will accompany the immunization program will reinforce the importance of getting immunized, try to break down any barriers people have about safety concerns or effectiveness, and at the same time, focus on the fact that once you're eligible, you're always eligible. So just because you've made a decision in March not to choose a vaccine, you will be ready and available to vaccinate you at the time that you're going to make that choice and protect yourself and protect others around you.
Follow up, Steph?
Yeah. The Saskatchewan Health Authority has mentioned, recent as last week, that our test positivity is still high, our reproductive rate is still higher, our case rate is still high, and there was a risk to loosening public health restrictions, which we have seen to date. What is the risk to the health system right now where we are seeing variants in the community, our test positivity is still above 5%, even higher in a place like Regina? What is the risk to the health system?
I'll start, and Scott, maybe you want to follow up. Yeah, we have seen the variants in Saskatchewan. The testing that we received just the other day was showing that the variants were here for over 60 days. We did see those. The good news is even those variants were present in the province, our numbers started trending down. And the numbers are still at a higher rate, but where they're going and what we've seen over the last little while with the advice of Dr. Shahab, we're trending in the right direction. So we feel that this is going to be a good opportunity to start loosening up some of the restrictions, and there's only been one restriction that's been loosened up as of right now, and that's the personal household gatherings. And we're looking at the worship services for later on this month. In saying that, it's always that fine balance that we're trying to do. We've also seen our hospitalization numbers decrease significantly in the last month. We've seen our ICUs come down significantly in the last month. So that was always the goal when we started this challenging journey with the pandemic, was to protect the healthcare system and to make sure that people could get vaccinated as soon as possible. So with the introduction of new vaccines that are coming online, and we're getting more vaccines in the next 3 weeks than we have in the past 2.5 months, that balance we're always continuing to find the right place where we can always be to make sure that people are safe, but they're also able to get back to somewhat of a normal life.
We'll take a...
So the only thing I would add is since the inception of the pandemic, there's been a balance and multiple strategies to try to contain, mitigate, and delay the virus, whether that's contact tracing, whether that's lab testing, which, as you know, we've got testing available all over this province since July 14th that's been unused, and we still need to keep continuing to do that following public health orders. But I would say, to the minister's point, the most definitive tool we've had is the tool of vaccination, and we've already seen dramatic results in some of our most vulnerable, where we, I think we said this before, we know, before Christmas we had 200 plus, infected individuals in long-term care. I think today we have 7. Not having those types of outbreaks to manage with some of our most vulnerable has been a huge relief on the system, and that's directly due to the vaccination program. So the race is on, and it's vaccination, and speed matters, and that's why our program is directed at doing just that.
Take a question on the phone line.
We have Phil Tank with the Star Phoenix.
Yes, can you clarify by what you mean by phasing out the process of contacting people by phone? Like, is that happening immediately? And what about all the people who may have called the 811 helpline and been told, sit at home and wait for a phone call, that may not be watching to see age groups announce their bookings and stuff like that? What provisions have you made for them? And do you have numbers of an estimate of how many people have been told that?
I'll start on that. There was, in our phase 1 category, there was 190,000 individuals in the province that we had to contact, so that you can understand that that's a very large volume. So we were trying to get to them as much as we possibly could. The transition time will happen tomorrow, when the phone calls will stop later on today of going out, and now we'll be prepared to receive phone calls as well as the online booking side of things.
Follow up, Phil?
Yeah, can you clarify a few things for me about what people need? Like, the people, when you say people need identification, will they need photo identification to prove that they are who they are? And if someone doesn't have an email address or a cell phone number, or a cell phone, what happens with them with this booking system?
Well, certainly if they don't have the technology of a cell phone or an email, that's why the phone line system is there, so they can do it kind of the old-fashioned way, call in, write all of their information down on their calendar when they have their appointment. And what they need is they need to be able to have their health card, no different than booking online than on the phone. They need to have their health card information and all of their pertinent date of birth and everything that just went through on the demonstration.
Take another question in the room. Colton?
So if I did reach out and I happen to not have family that can book for me or a friend that can book for me, could I just go to a clinic or have someone do that booking for me through the SHA if I didn't have a phone or an email?
You could have, like, as was demonstrated, you could have a family member or a friend or a neighbor reach out and do that for you and be able to do that. As long as they have your information of your birth date and your health card number, they could help you through the process. And we encourage people to do that. If you know of somebody that might not be as tech savvy, to either reach out on the phone, get them the information, or help them through the process, because we want to get them vaccinated, as many as we can, especially in the seniors. And I got to keep emphasizing this. If you're not eligible, please don't test the system. We've seen that in other provinces. British Columbia had 100,000 people eligible, and they had 1.7 million people try to access, and it crashed the system. We need to be able to make sure that our seniors have the first opportunity to be able to book in their appointments so they can get vaccinated first. That's our priority.
So the only thing I would add is in those situations, that's one of the reasons why we have the phone line, but also to highlight that both in phase 1 and phase 2, there are vulnerable populations that are identified that might not have access to a landline, and that's why we are having mobile clinics, and that's why we're setting up clinics and prioritizing those folks in centers like group homes or in homeless shelters, and we'll go to them so that we can ensure that we're getting the broadest swath, even though the technology might not be there. And as the minister said, the easiest way and the fastest way and the 24/7 way is the booking system, but that's why we do have some of those other fallbacks, because we know not everybody has that technology or capability.
Follow-up, Colton?
Just kind of a follow-up to what Steph was saying. So the people that don't end up getting their vaccines, and we keep track of who those people are, will there be, I guess you said that there will be kind of a campaign to encourage them to get their vaccines, but it's never going to be mandatory. It's more just keep them on it and maybe try and get them to do it.
You know, I would say that getting vaccinated is the best way to help the entire community in this province get out of this pandemic quicker. But vaccines are not mandatory, just like testing is not mandatory. And people are making choices right now. And we hope as more information comes forward on available vaccines and their safety and efficacy and some of the real world evidence that we're seeing out of places like Israel, where high efficacy rates, around 94%, across the spectrum of age groups is exactly what we need to happen here. And we'll hopefully have lots of folks from the province come up and decide to get their vaccinations quickly.
We'll take another question on the phone.
We have Laura Fominov with CKOM.
Hi there. The message has been so far, take any vaccine that you can get, whether it's Pfizer, Moderna, or the AstraZeneca vaccine. So once everyone has their first shot, does that apply to the second shot? How will you be tracking who gets what for the second dose, and can some of those vaccines be mixed?
I'll start on that. We certainly are encouraging everybody to get whatever vaccine's available. Any vaccine is a good vaccine. And we want to make sure that we're tracking it as well as we give you a card that will tell you what vaccine has been administered to you. We also keep track of that on our system internally. So we will make sure that that is verified when you get your second dose. And we want to just, again, encouraging people to please get out and get vaccinated. This is the best way that we're going to be able to get back to our normal life.
Follow-up, Lara?
Yes, please. Last week, Mr. Livingstone mentioned that the website could take about 1 million hits per hour. If you have about 10,000 people and they're trying 100 times to get to get on the online system, that's 1 million hits pretty quickly. So what assurances are there that this website's not going to crash?
Well, I would say there's no 100% guarantee of anything, and as we've talked about, we know what's happened in other jurisdictions when they have brought up these systems, and one of the things that's happened is, you know, in BC, I think 1.5 million people went online, with the vast majority of them not being eligible, and that it crashed their system. So understanding some of the risks that have happened across the country, we've done a lot of work around ensuring that we address any potential failure points of the technology. We're confident that not only do we have enough hits or capacity, and as I said before, and just a reminder, we're not limited on an hourly basis per capacity. We have real-time monitoring of the system so that if it needs to be increased, it can be increased in real time. We believe that we have addressed any risks associated with major failures throughout the continuum, but again, there could be some small glitches, and it's why we're trying to reinforce only those eligible book as we get through the system and get to learn how it's performing, and we'll monitor that on an hourly basis.
And I'll just add into that. That's why we picked from 85 and over to start. So we had a very select amount of people that haven't, and we've been vaccinating this group for a while right now. There's going to be a low number there, so that gives us an opportunity to test the system to see how the uptake is, and that's why we didn't open it too wide. When we get through that 85 and over group, then within days, not weeks, we are going to have those other age categories start opening up. So that's why we started it very slow to make sure that everything is going to work and we don't overload the system. And then we will start opening up days after that to different age categories.
We'll take another question on the phone.
We have Laura Sharpatelli with CBC.
Hi there, this is Laura Sharpaletti. I know that up in the north, vaccinations are open for people who are 50 and older, which is different from the south. And we're wondering if the online booking system is going to be adjusted for northern communities based on that information.
I can touch on that. No, the 50 and over were done very specifically for the northern communities, and we had the Moderna vaccine go up there right away so we can get that, and we've had good uptake in those areas. This is for more the mass vaccination clinics and the mobile clinics and those two appointment ones. That's what this system is for. We will still, once we get to that 50 age category, we will start opening that up in the north, but it's very challenging to have two different age categories in two different parts of the province, so we wanted to make it consistent. But again, I'll emphasize that these age categories are going to roll out in days, not weeks, to be able to open that up. So it should be only a matter of a few days to be able to get to that 50 and over category. But we have had good uptake in the north so far.
And we'll come back to the room.
Where are the staff who are going to be doing, I guess, manning the phone lines for this, where are they coming from? Like, where did you have to pull resources to make this happen?
That's a good question, Steph. And I'll ask Derek to answer that question since he's closer to the operations. Derek, can you answer that question? Did you hear it?
Regarding the staffing,
it was regarding the staffing for the booking office online, or
so we have a
call-in
different staff that are supporting that initially, and as a base, we have engaged Public Service Commission staff, leveraging government workers to provide that service, and we've supplemented that with other resources such as contracted agents that can support the call-in lines, and then we also have additional SHA employees, such as through Labor Pool, as well as people from the 811 call line that could supplement as needed depending on the volumes that were received. So we have a robust staffing plan for the booking office.
Yeah. Minister, you mentioned in your opening remarks, this is, vaccines are the way to get back to a rider game, back to concerts.
Yep.
I know it doesn't sound like you're looking at making vaccines mandatory, but is the government exploring anything like a vaccine certificate that say, you might need to get into a football game, or allow, or have some kind of a give and take, like maybe you lift some restrictions for larger gatherings, but people who are vaccinated have to have some kind of pass to show that they can enter. Like, is that something you're exploring?
That's a very good question. No, it's not something that we're exploring right now. We're encouraging everybody to get vaccinated on that. That again, it's not just for yourself, it's for your family, for your neighbors, and for your friends to be able to protect them as well. We're not looking at that. There has been some talk at the federal level about a vaccine passport, but I'll leave that up to the federal government to be able to make those decisions. Again, we want to just keep encouraging people to get vaccinated. And I'll emphasize it one more time. Please don't access the phone or don't access the website if you're not 85 and older right now. We will inform you within days to be able to open that up to everybody.
Okay, with that, we'll just go back to the minister for closing comments.
I just have one quick closing comment on a personal note. I just want to wish my mother a happy birthday. Thank you.
Thanks, everyone. That concludes today's press conference.